Hello folks, I'm back again. This time we're going to be talking about the complications of diabetes. Remember I was telling you about if you're uncontrolled with diabetes, it will lead to different complications. It is the complications that we don't think about or hear about them. Diabetes is one particular disease that is accompanied with so many other diseases or comorbidities. Anyhow we look at it, there are serious cases. If you are not controlling your diabetes, you will end up with eyes problem, which we call retinopathy. You can end up with kidney failure or what we call nephropathy. You may also end up with nerve damage, that is blood not flowing very well to the extremities, or what we call neuropathy. All of them are so disastrous. Diabetes can also lead to cardiovascular problems, heart failure. All these are complications of diabetes. I don't want to go into other problems like complications like sexual dysfunction, but the problem is also there. Sexual dysfunction is a result of neuropathy. So once the nerves are damaged, they are damaged everywhere there is nerve endings, where is arteries and veins. The complications are enormous. But we can also avoid them. We can avoid these complications. How do we avoid them? We avoid them by also understanding how to deal with diabetes. You don't allow diabetes to take the driver's seat. You will be the one to drive. What do I mean by driving? You will know what to eat, when to eat it. You will know when to say no. You will know when you're overloading yourself. You will know when you are doing what is not right. And also making sure that you're taking your medications at the right time and checking your blood glucose level. It is important, as someone who's living with diabetes, to go to eye clinic, either optometrist or ophthalmologist, whichever one you choose. You go and check your eyes. It is left for the optometrist to tell you, depending on how your eyes is, to tell you the duration of checkup, whether you should be coming every 6 months or every year or every 2 years. Some people will allow themselves for diabetes to damage your eyes. And once your eye is damaged, it becomes blurry. You bleed at the back of the retina. Maybe that's what's causing the blurriness. So you need to work hard to make sure you go for eye checkup every now and then. Where you need glasses, you wear them. If you're bleeding at the back of the eyes, the optometrist or ophthalmologist the optometrist will refer you to optician to check you, and possibly you'll undergo laser treatment to correct the bleeding spots at the eyes. So by so doing, you're also stopping yourself, preventing blindness. You have greater chances of becoming or suffering from cataract as somebody who is diabetic or living with diabetes. So if you are living with, if you're going for eye checkup, the doctor will also know whether you're suffering from cataract and possibly prescribe some eye drops for it to be uh, inserted in your eyes. And then when it becomes necessary that you have to do the operation to remove the opacity, then you will do it to prevent blindness. Also, why it is important to be careful with the amount of alcohol you consume and what you eat. Remember that most things we eat or drink go through the kidney. You have know about the ultrafiltration of the kidney if you drink a lot of alcohol. If you drink some medications, like you have over-the-counter medications that are not necessary, like all these weight-losing medications, which we call kidney busters. Those things, those medications will destroy your kidney. As somebody who is suffering from diabetes, you're not supposed to take those medications. You are not supposed to take those medications because the consequences of such medications are high. So when you are indulging in taking these kind of medications that are not properly prescribed, whether they're antibiotics, whether they're over-the-counter medications, without going properly through the doctor to prescribe for you, you are risking the chances of getting your kidney injured. And once that happens, with the combined effect of living with diabetes, you will end up on dialysis. Dialysis is not a good kind of treatment for anybody, whether you are diabetic or not. The prognosis for people who are on dialysis is poor, but that's not what we're talking about today. So all I'm saying is that do your best to avoid going through dialysis by doing what is right, taking the right medication, eating the right food, avoid drinking alcohol. It is also very important to avoid neuropathy. Even neuropathic pains alone is not something anybody would wish his enemy. It is so excruciating. Once your legs become necrotic as a result of blood not going to the extremities, or maybe you have a little wound as a result and it degenerates to any form of wound, it can now continue to expand to the point that, especially if you are uncontrolled, healing becomes a problem. So it is important that as somebody living with diabetes, that you're wearing your slippers or palms, or as you may call it, whether you're in the house or whether you're outside. As somebody living with diabetes, you're not supposed to go barefooted at any point, at any time, whether you're inside your room or outside your house. It is against the rules of diabetes. Anything could, remember, if you have neuropathy, you don't feel you become insensitive to any object, whether it is a sharp object or whether it is a blunt one. You become insensitive to it and you can get injured. I remember when I was living in Canada, I was looking after this patient who had nail. This nail has gone into her legs, but she doesn't feel the pain. She doesn't feel any pain because she had nerve damage. So because of the nerve damage, there's no more sensation in the extremities. And now that continues to, the wound continues to expand. So when she came to the hospital, we realized that there was nail inside the sole of her feet. But she didn't know that prior to her coming to hospital. Why? Because from what she said, she was attending to some of her domestic chores, both inside and outside, and she didn't know when that happened. Another clear example is also I think that was, I don't know whether it was in America or England. This patient came. She already, we established that she has neuropathy. But in the course of the treatment, she was feeling cold. And that's another thing, as someone who's living with diabetes, you experience. You experience coldness on the lower extremities, on your feet. You're feeling this cold. So this man, because of how cold the weather is during the winter months, he put his legs on the heater, just to make it warm. Along the line, she was not feeling that the heater has burnt the sole of his feet. And what he was hearing was shh, shh. He didn't know that it was kind of fats coming from the leg and dropping on the heater because of neuropathy. At the end of it all, because of how bad the leg was, and the wound becomes so open, you could see his bone. So the best option then to save his life was to amputate, below knee amputation, and that's how he ended up. So this is neuropathy. Neuropathy, once you have nerve damage, the sensation decreases, or in most cases, it's not even there. And what do? You continue to suffer from neuropathy. And remember, some people with diabetes, they will tell you, oh, I'm not feeling a sensation on my leg. My leg is feeling numbed. It's neuropathy. Sometimes you'll be feeling slight pain. That's the onset of neuropathy. So when such things happen, don't take it lying low. Continue to kind of, throw your leg as if you're flipping it to increase circulation on the lower extremities. You have to continue to do that. And also, if you have somebody to be massaging your feet once in a while, you continue to do that to increase circulation. So that is why we encourage people who are smokers and still diabetic to stop smoking, because smoking in itself will cause what we call reduced blood circulation. It decreases the circulation in the blood. Diabetes itself decreases the circulation. So you can imagine when these two have synergistic effect on the circulatory pathway. So that becomes a problem. And also, as a smoker, it also impacts on the heart. The smoking makes the blood thick. Your blood has to be thin. You see what I mean? So, but if you smoke, the blood becomes thick. And that also increases the workability of the heart. So the heart now works so hard to make sure that it pumps blood into the system. Over time, it becomes very difficult for the heart to pump the blood. That's why I did mention it when I was talking about the treatment and the other pharmacological therapies we use. I forgot to mention aspirin. Aspirin is one medication as somebody who's living with diabetes should not avoid, because diabetes makes your blood thick, and it's even worse when you smoke or drink alcohol. So you need to be adding 75 milligrams of aspirin every day. I didn't say 150 milligrams. I did not say 300 milligrams. I say 75 milligrams. Or, that's if it's coming from Europe, and if from America, it's 81 milligrams. One tablet daily. You need to be taking that. As somebody who is suffering from diabetes, if at any point in time you have chest pain, it's an emergency, situation. Do not take it lying low. Do not ignore that pain. Once you feel you have this sensation, sorry, this pain, squeezing pain, stop. You can, if you have any aspirin with you, you can take it at that instant, but also go straight to the hospital. That's a warning sign. Could be anything. It's a warning sign. So don't take it lying low. There are so many many things that connect to the heart, which you should not, kind of overlook. So the aspect of diabetes, when we talk about what is it called now? The complications of diabetes is not something anybody should push aside. It's something we continue to explore. Maybe think about it more, try to find out more about what we should do next to avoid any form of complication. The complication of diabetes is not what anybody wants. There are so many of them. It affects the heart, it affects the eyes, it affects your lower extremities, it leads to amputation, it affects the kidney. We cannot estimate or rather underestimate its problems. So we continue to do our best to know more. Maybe the